Good morning, students. In the last class from the chapter Why Do We Fall Ill, we have learned what is health, how the health can be spoiled, and what are various factors that are needed to maintain good health. As we already have learned what is health, now let us learn what is disease. And how does it appear, and how can we identify it, and what are symptoms and what are signs and types of diseases. All these things let us learn now. Disease word, it is self-explanatory. That means it itself is giving its meaning. Dis ease. Ease means to be at comfort. Dis-ease means not being at comfort. So, disturbed ease or the state of being uncomfortable is known as disease. Now, let us know what is good health and what is disease free. What is good health and what is disease free? See, if a person is not having the needed ability for his or her job or for social work or for physical requirement, the person is not having the ability to do his or her job or his or her social activity or his or her physical requirement, then that person can be said at, he or she is not at good health. The persons can be in poor health without identifiable physical disease. Persons can be at a poor health without any identifiable physical disease. Like if you take a dancer, a musician, if a dancer is there, dancer need to stretch his all body parts with flexibility. If the dancer is not having the ability to stretch his body as per his or her requirement, then even though he or she is not having any physical disease, then also he or she is said to be not at good health. If you take musician who may be making some good notes through flute, musician using flute, he must be able to have good control over his breathing. He must be able to increase his breathing or reduce his breathing as per the notes that he or she is intended to make out through flute. If that good breathing ability is not there with that person, then even though there is no other physical identifiable disease in that person, still we can say that the person is not at good health. That means persons can be in poor health or persons are said to be not at good health without identifiable physical disease. Then what is disease free? A person who is free from any physical disease is said to be at disease free condition. A person who is not having any physical disease is said to be at a disease free condition. This person may be healthy, may not be healthy. Means that person is just physically free from diseases, but socially or mentally he may be being well or he may not be being well. If he or she is being well in all three dimensions, then only that person is said to be at a complete good health. Otherwise, the person is said to be at a only disease free condition. But here in our chapter, we are not going to discuss about the complete good health. Instead, we are going to discuss about the normal, physically disease-free condition or physically diseased condition. Right. If you take the organization of our body is made up of various cells which in turn make up tissues, which in turn make up organs, and organs in turn make up organ systems. If you look at such organ systems, digestive system, musculoskeletal system, excretory system, circulatory system, like so many systems are there. If you take the digestive system is having mouth, oral cavity, food pipe, stomach, small intestine, large intestine, like various parts. And what is the role of this digestive system? Digesting the complex food into simpler units so that that food can be absorbed and can be utilized by our body. And musculoskeletal system, which is made up of various types of skeletal muscles and bones. What is its role? Its role is to carry out body movements. Right. When a person gets a disease, at diseased condition, the functioning and or the appearance, sometimes functioning and appearance may look normal, okay, and functioning may be abnormal. Sometimes functioning may be normal but appearance may not be normal. But when a person is at diseased condition, functioning and appearance of one or more of our organ systems, they get changed to worse condition than from the normal condition. Person is healthy, but after some days, you say that the person is not healthy, physically is not healthy. What I mean by one or more of his organ systems have changed to worse. Worse means from good to worse, negative condition. Okay, right. So when they change, these changes of that organ system in their functioning and appearance, the changes of the organ system in their functioning and appearance, they exhibit certain symptoms and signs, not under symptoms and signs of the disease. When the organ systems, they change to worse condition from the normal condition at a diseased condition of the person, what will happen? These changes of the organ systems, they exhibit certain symptoms and signs of that particular disease. And why symptoms and signs, two different words? Why not symptoms or signs like that? Because symptoms are something which the person feels. Signs are the changes that are perceived by the doctor or physician based on the said symptoms of the patient. Okay, so symptoms are felt by the patient and signs are observed by the physician. They are the differences between symptoms. So symptoms are the changes that are felt by the persons, like headache, loose motions, cough. Okay, all these things are said to be symptoms. If you look at headache can be a symptom of normal stress. I take 4, 5, 6, 7, 8 classes entire day. Due to the stress of these many classes, I get headache. Some persons, they do not take any classes, but covering our brain, okay, there are 2 layers called meninges. Between the 2 layers, some liquid will be there, right, which is called cerebrospinal fluid. So these meninges, if they get inflamed due to some infection, then also the persons get headache. Person who gets headache due to stress, persons who gets headache due to meningitis, both are different disease wise. But Same, headache only. Okay, right? And in so many other conditions also, some cancers also, brain cancer also, sometimes a person frequently get headache. So, due to various different types of disease, symptoms look common. So, based on the symptoms, we cannot simply decide disease. We ourselves cannot decide disease. Based on the symptoms, the physician will go for further examination of other systems of the body. Okay, and if it is required, the physician may be asking us to go for laboratory checkup also. And they identify the signs. Based on the signs, SIGN signs, okay, they come to know what exactly that the disease is with the person, right? So, headache can be of stress or meningitis or some cerebral cancer or some other thing. But what actually the root cause for that headache? That the doctor only can identify. We cannot. So, self-diagnosis of diseases is always dangerous. Right? Signs are the changes that are checked by the physicians, by their visual observations, followed by the laboratory checkup. But first, why they do that visual observation? Based on the symptoms. Okay. And these signs, why they observe for the diagnosis of the exact disease. So, symptoms, they form the basis for the signs in order the disease can be diagnosed. Right. So, signs give more definite information for the exact diagnosis of the disease. Symptoms cannot give exact identification of the disease, but signs give more information. Right. Diseases classification. Let us first take based on the duration of the disease and based on the severity of the disease and based on certain symptoms that are exhibited by the disease. How many types of diseases are there? Diseases are of two types based on the duration, severity and symptoms of the disease. They are acute disease and chronic disease. Acute is this explains the milder. Chronic, it explains something severe. Acute diseases, they just are going to exist for shorter duration. Whereas chronic diseases, they are going to just be with the person for longer duration, maybe even for lifetime also sometimes in some diseases. Right? If you take any disease, a disease is caused by what? The functioning and appearance, the functioning is going to become abnormal by one organ system or more organ system. So, in any disease, proper functioning is not going to be there. That means poor functioning will be there. So, poor functioning of one system, it may affect the general health of the other systems also. So, if kidneys are not properly functioning, other systems of our body like heart, lungs, brain, all these things also may just get affected. May, not compulsorily. In acute diseases, the general health is not much affected because of the disease. Whereas in chronic disease, even though the proper functioning is actually gone damaged with only one system, other systems also will be becoming poor in their function. Hence, the general body health also is affected in chronic diseases. Right? Like, if you take the example for acute disease, common cold and normal dry cough. If you take chronic diseases, tuberculosis, AIDS, like diseases. Now, even corona also. Right? There is no prolonged loss of general body health. Actually, general body health is not affected much in acute diseases. Even if mildly, if it is getting affected also, it will not be prolonged. The loss of general body health, it is not getting prolonged for longer duration. It will be just for shorter duration only. Maybe with the cure of the disease, even that improper functioning of general body health also will be becoming normalized. Whereas in the case of chronic diseases, there is prolonged loss of general body health. After the actual disease is cured also, the general body health will be showing poor performance only. Right? In the case of acute disease, after the recovery from the disease, The persons will not be losing body weight. The persons will not be having any shortness in breath. The persons will not be observed with some tiredness or any other symptoms. After the recovery from an acute disease, the persons will not be observed with any weight loss or any shortness in their breath or any tiredness in their performance of the functions. Whereas, in the case of chronic diseases, after the recovery from disease, the persons will be still observed with shortness in breath, like how they were having shortness in breath during the time of disease. The persons will be having tiredness, like how they were having a tiredness during the time of disease condition. And by the recovery time, the persons will be having loss of their body weight and compared to their actual body weight before they have come across that chronic disease. So these sort of symptoms will be there. And because of acute diseases, there are no drastic long-term effects. Whereas because of chronic diseases, many drastic long-term effects will be there. Throughout life the person has to suffer, right? So with this we have completed what is an acute disease, what is a chronic disease, and what are their differences. How a disease look like, all these things we have completed, and we have understood what is the difference between disease-free condition and good health condition, right? Remaining things we will discuss in the next class. Thank you.